Good afternoon, everyone. On behalf of the Riverside County Medical Association and the Inland Empire Foundation for Medical Care, I'd like to thank you for attending this webinar. Our focus today is reopening your practice during this COVID-19 public health emergency. I'm your co-host, along with Mitzi Young, who is the physician advocate for RCMA and CMA. The two of us are going to work together to provide the most up-to-date information and guidance for opening your practice or expanding your practice back to where it was previously before the COVID crisis. I'd like to begin by thanking Dolores Green and the RCMA team. This has been a team effort to gather this information and to present it to you. I'd like to give you one caveat. We cannot cover all possible information pertaining to every practice and every situation. There is a very substantial need to take this guidance and to individualize based upon your particular practice and needs. I'd like to also mention that Mitzi Young is available to you through RCMA. We have contact information at the end of the presentation, and she is standing by and willing to help you with individual questions or challenges that might arise. During the course of this presentation, we're going to keep everyone muted. Otherwise, there's too much interference to present. We're going to ask you to put your questions in the chat section, or if you'd prefer to, at the end, we can unmute and take your questions and do our best to answer them at that time. There is also a reopening checklist, a white paper that we've put together that comprises the information that we're going to present today. That and other resources are available on rcma.org. And again, you will have a reference to that at the end of the presentation. One other thing I'd like to mention right off the bat is that Manifest MedX now has COVID test reports available for each practice. If you have any questions, you can get in touch with Jenna Arellano. She's with the Inland Empire Health Information Organization and Manifest MedX, and she can help you work through any challenges that you might experience. We're going to end this presentation with a local update from Dolores Green, who has worked diligently with the Oversight and Task Force in Riverside to present the latest information on where we stand with this challenge. So without further ado, let's begin.
Thank you, Dr. Bittman. Hello, everyone. Welcome to the Reopening of Your Practice webinar. These recommendations are really based on the healthcare landscape that is right now. So please keep in mind the information will change over time as it's already done, even just this, you probably all know that. There's some industries that are starting to open up, and so we're really glad to be able to present this to you. Perfect timing right now. You can get up-to-date information, as Dr. Bittman said, from the website of your local San Bernardino County Medical Society, Riverside County Medical Association, and the California Medical Association. I really want to make sure that everybody understands and hears what I'm about to say. We are your one-stop shop. You can call us for anything. So please, please, please use us to your abilities and for your resources. So here's the thing, timing and pace is really going to be important. And to use the words of our governor, it's starting back will not be like a light switch that we just turn on and it's all go. It's going to be slow, and it really should be a process that is slow and methodical so that we can be successful long-term in our medical practices and for our patients. So as practices reopen, revenue and patient volume may increase slowly and unevenly. Physicians should be careful to consider their capital needs for reopening. And all available funding sources that they have, both private, bank loans, and public, such as the SBA loans, government grant funds, those kinds of things. For more information about financial resources that can support your practice, please see the RCMA or the CMA or the SBCMS COVID-19 resource pages on those websites, and they will all be given to you at the end of this presentation. So now is really the time to look and take a deeper dive at your payable amount. These are the things that you owe folks, your vendors, that may be at an auto withdrawal from your bank account, credit cards, bank loans, vendors, those kinds of things. You want to make sure that any loans or advance payments that need to be considered in your practice payables go forward over the next few months, that you have a really good plan on how to get those things paid. I think that that's a real important piece that some folks are going to forget about. We don't forget that the bills keep coming in no matter what our situation is out in the world, it seems. Okay, so next slide. So financial considerations. So you really want to make sure that you're looking carefully at your patient balances, okay? Collect up front your copays and deductibles. Even if you're doing telehealth, you can do those kinds of things via credit card if you need to. Follow up on outstanding patient balances and communicate those payment plans that you may have. And if you do not have payment plans in your practice and you would like to start doing payment plans for your patients, I would be more than glad to help you one-on-one. I am your physician advocate and can help you one-on-one assistance. Be sure to run these reports, super important. And I would think that you would need to run these every 2 weeks, probably for the next 4 to 5 months. I would suggest that you look at them and you be sure to do good management in your billing. A lot of things have changed. When we kind of turned off the lights, it was abruptly, everybody just kind of went home and we figured out how to do this remote working from home. And so there might be things that were just left untied. And so we want to make sure that we get on top of those. The other thing that you want to look at is your revenue streams. So it's important to have an accurate understanding of those revenue streams, as payments may be delayed. Compared to past revenue trends would be a good idea. So if you look back over the last quarter or last year at the same time and kind of get a sense of where you're at now. Any incorrect due to the payer delays, that could happen. Payers may, not be really implementing that telehealth requirements and other related factors because it's kind of new for all of us. So you want to make sure that your revenue streams are really kind of tight and you've got a handle on them. That's really important to do. Okay, next slide. All right. So really, to review your contractual obligation is really going to be important, right? So you're going to re-examine those contracts and any obligations. Be sure that you're meeting the timely filing and that they are actually meeting, the payment regulations in California. You want to look at your claims and your appeals. Is everything been appealed? Is it all out there? Are your timeframes still within regulation? That's really important. Your submission, your encounters for your quality data, if you are on any of those kinds of plans. Employment agreements, those are going to be big, especially for providers. That doesn't just mean physicians, but it could be your physician's assistants or your nurse practitioners. If you're not coming back full-time, things like that, or bonuses are to be paid through those employment agreements, you want to take another look at that. Your landlord obligations, obviously with any of your vendors as well, make sure that you're looking at those agreements and kind of going over them and know exactly, having the finger on the pulse of what you need to know regarding late payments and things like that. We want to make sure that you develop a plan to revise your budget. This will help on a go-forward basis as things move to a normal business, and that will take time. So practices can easily identify what costs the most on a monthly basis and adjust as necessary. And with that, I'm going to hand that back over to Dr. Bittman. Thank you.
Thank you, Mitzi. Thank you for all that information. It's really important that we make sure that we begin on the right foot. As we start to move through this, you have to realize that we're really barking up a new pathway for all of us. There's not a lot of experience in doing this, and frankly, we're paving new ground as we move ahead. Many of you have probably heard the telehealth presentation that we did 3 or 4 weeks ago. If not, there's information on the website on RCMA Docs that can really provide a rather succinct overview of what you need to know. The bottom line today, however, is if you haven't already implemented a telehealth strategy, you should immediately consider doing so. I've had the opportunity to speak to physicians all over the United States as well as Canada, and I can tell you they've really taken to it. In fact, most physicians are impressed with the fact that this really eliminates the inefficiency that's associated with no-shows. That if the person is not there when the call is made, they can simply call another person as long as they've set up the call or the FaceTime or the telehealth visit within a certain period. So it's actually become more efficient. Many physicians feel that they're able to get more done. And my recommendation is you do proceed to immediately consider integrating this into your practice. I can also tell you that there is a major movement from the AMA right now to continue some of the guidelines that have provided leniency for us at this point so that we can extend telehealth. The regulations that exist right now are very much in our favor. As physicians, there's an opportunity to see patients from a telehealth perspective and receive the same payment that you would have received on a face-to-face visit. Across the nation, health insurers, health plans have worked diligently with their providers to try to ensure that people are being seen. And in most cases, the payers have actually allowed the use of telephone only for the use of just telephone rather than synchronous audio and video, so that you can actually bill for that service as a telehealth visit. This last standout that I'm aware of in the region is CMS, and I'm pleased to say that last Thursday, they basically agreed as well. So you can now perform telehealth visits with just audio if that's necessary. They, of course, did this based upon the fact that many elderly seniors may not have access to a smartphone or a tablet. The bottom line is that the intent is to try to only see the patients that we need to see, meaning routine follow-ups or other follow-ups that can wait should not be seen in your office. You're probably saying, why? The assumption now, despite testing, should be that everyone that walks into your office potentially has COVID. I know there's a lot of talk about antibody tests. I follow this very closely, as well as the latest advances in PCR. And as you probably heard or read, there are a lot of false positives and negatives. So we can't rely conclusively on those tests. A number of physicians have basically started a practice of seeing their patients who were well in the morning or afternoon, and vice versa for those who may be symptomatic. Again, my suggestion is to recognize that every patient may be symptomatic and that you should take precautions with everyone. The last thing you want to do is have multiple patients in your waiting room or have your staff exposed unnecessarily. Each of you should check with your EMR vendor, first and foremost, to determine if you have an option for an integrated telehealth module for your system. If not, we have a great guide that we've been able to assemble. Our team has put together on RCMA Docs that can help you with some of the offerings for the EMRs that are used in our region. As we move forward during this transition period, I want to emphasize the fact that telehealth will not only allow you to see patients who do not necessarily require being seen physically. But they'll also give you the opportunity to continue to care for patients who are reluctant to be seen because they actually don't want to break social distancing and be out in the public. This is really important at this point because I believe that this is going to be a major pathway for healthcare delivery moving forward, even beyond this national healthcare emergency. When we think about telehealth and COVID, there are going to be some changes that have to be made in your practice. And some of that is going to be based upon how you organize and how you deliver care. Bottom line is that if you're seeing patients directly, we want you to make sure that you implement mask use, not only for yourself, but also for your staff and for your patients and our guests. We also recommend that you post signage on your front door. And we've created 2 signs, one in English and one in Spanish for you to use. That again is available at rcmadocs.org. We're also suggesting, and this has been utilized by many practitioners, a separate way for patients to come into the practice and leave the practice so that you don't have people crossing each other in the hallway. And finally, our recommendation is that you really figure out the best way to use your telephone system effectively. Instead of playing on-hold music, that's really where you can explain your workflows, the changes that are occurring in your practice, your expectations for patients, and what they can expect when they see you. This is an example of a sign that should go on your door. And this has been used across the county over the course of the last probably 6 weeks. Again, it's available in English and Spanish, and we suggest that you actually post both. The only thing you have to do is edit the telephone number where the X's are, and basically this is very straightforward and ready to go. Again, I think it's important that you develop a workflow and that you cycle through patients in the practice, having an individual enter through, let's say, the entry area or the waiting room, pass into an exam room, which is designated, and then exit through another door. You can rotate exam rooms for cleaning and for efficiency, which can actually allow you to see additional patients. What's really important is that there's a lot of screening that can be done by phone. And you should be asking about acute respiratory illness, fever, cough, dyspnea, but there are also symptoms like GI complaints, confusion, and of course, we've all become aware of the diminished smell and taste, which often is a harbinger of COVID-19 infection. I want to emphasize the fact that you should do this not only for your patients, but you should do it for anyone who accompanies them as well. And we suggest that only if necessary, one person accompany a patient. Do not bring a family in at the same time. Finally, I really think that developing workflows for patients who are cared for at home is essential. It's important that your staff has a scripted message that they can share with patients and provide that opportunity for the telehealth consult or visit, which many of them will greatly appreciate. Again, it's important to screen them on the phone and to make sure that they do not have the nuance of rip-roaring symptoms that instead of being seen in your office should be directed to the hospital triage area. As we move ahead, I think that you have to decide on the priority that you're going to use in your practice. I can tell you that I've not only been speaking with providers, I've also been speaking with surgery centers, and decisions are being made there not to perform ENT surgery at this point, which is absolutely logical. But it's important for you and your staff to get on the same wavelength and to decide which patients are those who you want to schedule and which ones should not be scheduled at all or could be scheduled by telehealth. Again, I suggest that you recommend that your patients come in alone. If they have to be attended by someone, the same question should be asked of the person who is attending them. It's really important to look at the CDC's guidance for outpatient and ambulatory care settings, and we have the link for it right in this presentation, which, by the way, you can get a copy of. We have the directions on the last page. Mitzi, I'm going to turn it back over to you.
Thank you, Dr. Bittman. It's so fantastic to be able to listen to you, Dr. Bittman, from the provider's point of view. So this is a great treat for all of us, including myself. So let's talk a little bit about right-sizing your practice. We want to look at staffing. So you want to really consider what you're going to need, going forward, certainly over the first few weeks that you're opening up and starting to schedule some patients. You want to make sure that you're bringing back staff and providers, physicians in phases as your patient volumes increase, right? And you want to be really methodical about that because, again, we've all suffered through this financially as well. So we want to make sure that we've got some really great success going forward in that arena of the business as well. So assess staff scheduling and just consider placing personnel on rotating teams perhaps. If you are able to give them access to EMR or your practice management system from home and they're able to continue to work remotely, that would be a really great suggestions for some of your administrative folks, the ones that are not seeing patients with you, like your MAs and techs. Also, if you are doing perhaps an evening clinic, or you might open over the weekend and have some hours there, you can kind of talk about bringing staff back in that arena as well. So incorporate the physical distancing. You need to really prepare those waiting rooms, put those chairs, 6 feet apart. I would really say just get rid of all of your paper, and that means any magazines that you have, brochures that you may have, you can give those out to the patients as you need them, and also any newspapers, things like that. So that would keep everybody safe in those waiting rooms. Also, your break rooms, you need to make sure that somebody is disinfecting on the regular in those break rooms, wiping down the tables, the handles, the knobs, things like that, as people will be in there, your staff obviously, getting their food prepared and things like that. And you need to have your testing areas. Physical distancing is going to be a big concern for all of us, and doing it right is going to make it a whole lot easier, and everybody on the team knows exactly what is expected and how to do this. Address your at-risk personnel. So these are going to be your folks that are 60 and over, have existing conditions. You want to really look at those duties that they're doing, and perhaps you might be shifting some of things to them or shifting some things off of them to other people. We just want to make sure that we keep everybody safe. They may do more triaging of your patients. Maybe they do have the ability to work from home, as I said before, so they can work in a different capacity in the practice. So take a look at that. You really need to acknowledge the current state for your practice and what expectations you have going forward. It helps to set the stage for everyone to be on the same page. And that's going to be critical, because not only is we going to be under a little bit more stress as we get back to work and start seeing patients, we need the staff to everybody be in sync, right? A lot of people are doing a lot of puzzles right now as they're off. So I say, yeah, put the puzzle pieces together in the practice and make it work amazing for you. The medical practice team is the doctor's most valuable asset. And so we want to make sure that we're communicating at a very high level and having as much transparency in that communication as possible to staff. So I always believe that attitudes are contagious, and we all have been challenged emotionally by this pandemic. So as much as possible, work to provide an environment that creates a sense of security and enthusiasm for the future. I recommend daily huddles. I think they're really fantastic. They only need to be about 5 or 7 minutes long. Staff needs to have an arena that they can talk about their feelings and concerns. may have them and they may not feel safe to do that. So we want to make sure that they are able to do that. Patients really look to all of you to be assured that they are in a safe environment, that they feel safe and secure. When talking with patients, it's important to listen to their concerns and fear, because they will have them. Everyone's talking about this as we come together. And stay positive to reassure them. Don't convey any fears you may have to the patients. Just stay as confident as possible. Next slide. Okay, hold on 1 second here. My computer's doing something crazy. Okay, here we go. So, you know, to really provide a refresher course on all of your OSHA, your triage, your infection control, this is really a great time to do it when you may be a little bit slower and you have some more space in between patients that you're seeing as far as time goes. We've got the great websites. Obviously, we're going to link them all for you, so they're right here. And then I want to make sure that you're getting your staff PPE needs. We can take a look at for you at RCMA and San Bernardino County Medical Society if you are in need of PPE. We'd like to hear from you. We know that it is really, really tough right now to get this type of equipment that you need. So just reach to us and see if there's something that we can't help you with. Screen your healthcare personnel daily. I think that's really important. You want to make sure that you're doing those temperature checks and any unprotected occupational exposure to the staff or by the staff should be, you know, assessed and monitored. So we've got a website here that should help. Follow your return to work guidelines for healthcare workers with confirmed or suspected COVID. Obviously, you want them quarantined for 14 days. If you have any questions when it comes to the employment side, we have an employment law practice that we partner with at RCMA and San Bernardino. So please just reach to us. We'd love to give that information to you. Next slide. Okay, so your office operations, I think this is a place where we certainly need to talk about, I'm sorry, you guys, my computer's not doing what it wanted to do, so I apologize. Hold on 1 second, sorry. Okay, so modifying your schedules, right? So when patients return to the office, we want to make sure that we can accommodate them in the way that they need it and also that the practice needs it. So consider scheduling changes for the short term and then maybe even on a permanent basis, right? So you might be bringing a lot more telehealth into your practice. I kind of talked about considering the evening and weekend appointments, just being cognizant of the time between visits. I think that's really important. You want the least amount of patients in your office as possible. And sometimes these waiting rooms can get pretty crunchy and have a lot of people together. So make sure that you're being careful about your space and space those out appropriately and develop, you know, obviously patient workflows. Insurance eligibility and benefits. So patients that are going to be coming back to your office, many of them, as we know, their life circumstances may have changed. Office staff should confirm patient contact information, including address and phone numbers. This should just be done on a regular basis, as is every time a patient comes into your office, whether it be through this pandemic or not. You should always make sure that that is up-to-date information that you have. Patients' insurances may have changed. Either they don't have insurance any longer or their insurance coverages have changed. So deductibles are higher, co-pays are higher, things like that. They went from a PPO to an HMO. Do you take that plan? Those sorts of things. So you're going to really need to do great communications with those patients. Again, you want to collect those co-pays and deductibles up front. Also, if patients have an outstanding balance, practices can offer the payment plans. If you need help with that, I'd be more than glad to help set that up for you. It's just really important to communicate with patients at the time that you're confirming the appointment. And that confirming appointment, my recommendation or best practice would be 2 days ahead of the appointment. That gives you time in case you have to leave a message for the patient. That's really the most important. And with that, I'm going to hand it back over to you, Dr. Bittman.
Thank you, Mitzi. Those were great points that you made. Again, I think the most important thing is that you look at this as an individual strategy based upon your setup and your needs, and that you work together with your staff, as Mitzi had appropriately suggested, to come up with protocols and strategies that are operational, not only for this coming month, but probably well into the future. I really think that when we think about a viral infection and when we think about this type of pandemic, there are expectations that this is going to be over soon. The world experts don't think so. So it's quite possible that we're going to be practicing social distancing and being extra vigilant over the course of the next few years. The EPA recommendations for cleaning should be reviewed by your team. We should be extra cautious at this time to make sure that we do everything we can to reduce the spread of COVID, especially on surfaces. And this takes us back to PPEs. I think the determination of whether or not you can acquire the PPEs that you need is going to be an important consideration in moving forward and reopening this aspect of your practice. I can tell you that the news varies considerably. There are places that appear to have sufficient number of PPEs, but in our region, it seems to be more challenging and more difficult. And I'm going to ask Dolores to comment on that in a minute. But I would maintain an open line of communication with your vendors and supply chains. Try to stay ahead of the game. My recommendation is, if at all possible, don't just purchase for this coming month. Consider that this is going to last longer, and do everything you possibly can to maintain that level of safety for yourself, your staff, and of course, your patients. The other thing that I'm concerned about at this time is drug shortages. And although we're really not seeing them to any significant extent at this point, this is something that we should all be vigilant of as we move forward. So really take a look at your supplies, make sure that you have what you need to be able to continue your practice effectively. Our final considerations are that this is only a transition phase. I think it's the end of the first phase, actually. I think that we've done rather well in Riverside and San Bernardino counties. I think that's a testimony to all of you working really hard on the front lines. Instead of seeing a massive logarithmic spike, what we've really seen is sort of a plateau. My only concern at this point is that with relaxing social distancing, rather than a second wave in the fall, you could see that this summer. So be prepared and make sure, again, even in the context of equipment and supplies, that you have what's needed to be able to continue. And I know that's not easy. Our goals are similar. We want to do everything we possibly can to optimize the health and well-being of our patients with and without COVID. You know, it seems like all we talk about is COVID-19, but the reality is everything else continues as well. There was a report today that there's a lower incidence of visits for coronary vascular disease. Very difficult to understand. We're seeing it all across the country. And many people believe that's because patients are symptomatic, they're not coming in, and they're basically falling into that death spiral rather than getting the care that they need. So again, let's be vigilant of our at-risk patients. In fact, my recommendation is that you make a list of those patients and you contact them on a regular basis just to make sure that they're okay. Finally, I'm recommending that you become aware of not only the federal, but the state and local guidelines. We really can work together and figure out the best ways to move ahead amidst this extraordinary challenge that none of us have traversed previously. There are going to be some disagreements along the way. There already have been. But the bottom line is that you have to use a sense of logic and caring, which you apply to your practices anyway, and make the best decisions for your patients. On behalf of our team, I really want to thank you for being on the front lines, for working as hard as you do. I know that your efforts have already made a huge difference in your region, and I hope that as we move forward, we can work closely and support each other so that we can optimize the care for those we are privileged to serve. With that, I'm going to ask Dolores Green to give us an update on where we stand in the context of public health in our region and recommendations to move forward. Dolores?
Thank you, Dr. Bittman. So what I will speak on is for Riverside County, because I've been involved in the Riverside County Emergency Operations Center. I am not familiar with San Bernardino, but I know San Bernardino could provide an update, and I know that they are providing an update. So as you know, today at noon, and I was not able to watch it because of our webinar, but Governor Newsom was coming out with his phase 2 reopening California, and which is a very limited opening. I haven't seen the specifics, but it pretty much relates to businesses, curbside pickup, etc. Now, Rivers and the state of California has had recommendations regarding the stay in place and cover your face and maintain your space, if you will. That's the kind of mantra here in Riverside County. Whereas Riverside County's health officer, Dr. Kaiser, issued directives for Riverside County residents about being at home or staying in place and using a face covering and maintaining space. And he, a week ago, extended that order to June 19th, which has created quite a bit of controversy, as we all know, in Riverside County. And so the Riverside County Board of Supervisors is having a special meeting tomorrow to evaluate what Governor Newsom's new guidelines are and how Riverside County may come into line with the state of California or continue its restrictions. And what happens is a county can be more restrictive than the state, but cannot be less restrictive. But right now, Riverside County is more restrictive. So that's just a quick update there. Regarding PPEs, we know that there is a problem, and our biggest concern is with PPEs once the economy is open, whether or not physicians' offices are going to be prepared to begin seeing more patients in their office. And that is why we are strongly encouraging you. And there is a financial advantage, again, to continue telehealth versus bringing all the patients back into your office versus the ones that you actually have to physically see. What I will tell you is that RCMA has been purchasing PPEs, and we have also received numerous contributions from IEHP and others that we have been providing the PPEs out to the physicians upon request. And we've been sending PPE survey or order forms out so you can submit your request. But one of our big stance with the County of Riverside in reopening is to ensure that the physician offices have adequate PPEs when this is done. So what I have, today I had a meeting with the county, and they have now worked with us in identifying a very large supplier and distributor that will allow smaller quantities of orders from our physician offices to directly order from them. So that is a huge boost to what the PPE needs are going to be. And as soon as that information is available, we will get that out to you as soon as possible. In the past, as you know, you've had to order like 1 million masks in order to get through to some of these distributors. So having this resource will be a huge benefit and will allow you to start seeing more patients if you choose in your offices, or again, we encourage telehealth as much as possible. Thank you, Dr. Bittman.
Thank you, Dolores, and thank you for your tireless work on everyone's behalf. You've been on the front lines for a long time, and we're very appreciative for everything you've done. What I'm going to do is try to answer some of your questions now. I'm going to begin with the chat notes. I can see that some of those questions have been answered already in the chat, but I'll review them and then we'll open up the space for any other questions. So you'll be muted during this part, and then we'll unmute you for additional questions. The first one pertains to whether or not this is being recorded. It is being recorded, and it will be up on the website next week. You will be able to get the recording and be able to share it with others, either in your practice or other practices that you know. Another question is, can you provide Mitzi's contact information? It's on this page here, but Mitzi, perhaps you could take just a few moments to talk about the types of service and information that you can provide. Mitzi?
There we go. I, for some reason, couldn't unmute myself. Yes, I would love to. You heard me say that, you know, we're here for you. I want to first tell you thank you, thank you, thank you. There's not enough thank yous that we can say for all of the provider offices out there and all that you guys are doing for our community and our patients. We really, really know who the heroes are. And so how do we help the heroes? Well, we can and we will, and we stand ready to do that for you. So on this page, I really would encourage everybody in the office to have this page, which has all of our contact information. As your physician advocate for the Riverside County Medical Association, I want you to know that I can provide one-on-one assistance to our members, and I am ready to do that. All of us are here at the medical societies and the state medical society for you. We really want to be the #1 source you go to so that you don't have to spend time Googling, you don't have to look for other ways to find information. We've got everything, we keep it up to date. That's our job, and that is our mission for you. So I think it's important, again, that you just keep all of this and let's work together. Anything that you need, do not hesitate to call us. We want to help you, our heroes, every single minute you need us to help you. Thank you.
Thank you, Mitzi. Thank you. I'm going to go on to the next question. It's is a telephone encounter, can it be billed as telehealth? As I mentioned before, CMS updated their regs last Friday, and now they will pay on par with face-to-face visit or telephone only. I know that IEHP does that as well. A number of other insurers are doing it, but if you have any doubt or question, you should contact your health plan, the health plan that you're working with. The question is, if you only have audio telehealth and not visual, how will this affect the Medi population? I think the explanation I just gave is pretty much the case. On the Medicare side, there's no problem. On the Medi-Cal side with IEHP, there's no problem at all. You can proceed with just a telephone. Let's see, what's the age limit for mask requirements for pediatrics? Pediatric patients, I have no idea. I want you to know that we spent quite a bit of time developing a pediatric strategy, and that mask requirement never came up. My recommendation is you contact the American Academy of Pediatrics. Next question, how long can we do telehealth with IEHP? The answer is absolutely unknown. We have no idea. The policies that are set forth now are temporary. However, as I mentioned, there are groups throughout the country that are rather influential who are recommending that we continue with our telehealth strategies that have been established during COVID moving into the future. Okay, next question. If you're seeing a hospital discharged for a COVID positive patient who is asymptomatic but does not have a negative test result on discharge, what is the cleaning protocol, regular versus EVS, and which mask is needed? I'm going to give you a personal recommendation right now. I've been in the field for a lot of years. My suggestion is that the antibody tests are not reliable. It's not 100%. You don't want to expose yourself unnecessarily, and that you use the same precautions whether you think the patient is negative or not. There's also a question of whether the antibodies actually confer resistance to this for the individual, and that's not certain because there are reports of people coming down with COVID more than once. So again, let's, for the sake of safety, treat everyone as if they have it. The basis for the prior relationship that was established initially in the context of telehealth has essentially been dismantled by CMS. What they're stating now, and it's in writing in multiple places, is that they have no plan whatsoever to audit any telehealth visit for a prior established relationship with a practitioner. That's CMS and HHS. While I believe that most payers will follow suit, I cannot be certain that everyone will. So therefore, I'd recommend that you check with your health plan. Again, I want to emphasize, it's stated clearly that there will be no audits to determine whether or not a prior relationship existed. And therefore, we are encouraging everyone to use telehealth, even for new patients. I hope that answers the question.
And
let's try to open it up
Sorry,
again.
I'm sorry, Dr. Bittman. I just wanted to add a little something to what you had said about that. Want to make sure that all folks know that we're here for reimbursement issues. So if you are getting claims back that are denied telehealth, or you need any help at all in the reimbursement side, we've got contacts in the payer world you and your staff will never be able to reach, and we're here to help you. So please reach out so that we can advocate on your behalf at the payer level.
Dr. Bitt, this is Dolores. There was a statement that RCMA and SBCMS is giving a telehealth webinar next week. We are not. I don't know, Mitzi, is CMA giving a telehealth webinar next week?
Not that I'm aware of.
So RCMA and SBCMS is not. However, if we have demand to give another one, we've given, I think, 5 so far, but we are happy to repeat it if there is a demand for it. So we will take a look and possibly schedule one for next week. It's easy enough for us to do if there's a demand. So if you think so, pop us a note and we're happy to put on another webinar.
And my recommendation is that you can request a copy of this presentation at membership@rcmadocs.org. You can also put in a request that we offer another presentation, either the one that you've heard today or our essential telehealth presentation. We'll be happy to offer it next week if there are sufficient number of requests.
So I will just add that I am on the CMA website right now. The webinar for update on telehealth reimbursement and privacy laws through COVID-19 will be on actually May 12th.
Thank you.
That may be what they were referring to.
Okay, any other questions?
Dr. Bittman, I did mute everybody because it was so crazy. So, and asked to use the chat button instead.
Okay. So if you have a question, let's do it through chat. There's too much noise when everyone is unmuted. We'll give you a minute or so to enter a question.
Dr. Bittman, if I could just make a point of information that when the orders to stay at home were put into place, that did not mean that physicians could not see patients. So during all of this time, patients have, and offices have been allowed to see patients. However, the recommendation has been to utilize telehealth, which I think has been very, very successful. So just a little bit of clarification on that. And it may be, even when the regulations are lifted, that patients will be hesitant to come to offices. And I would highly recommend that physicians do reach out, offer the telehealth visits so you can keep your practices moving and viable and have, you know, financial reimbursement.
Thank you, Dolores. You know, we have another question that I'm going to ask you to answer. It's what would be the best vendor to order products listed under EPA's List N for disinfectants to use against SARS-CoV-19? Dolores, are you still on?
Oh, I'm sorry. You cut out. What did you ask? My apologies.
Oh, that's okay. We have one more question that's come up. It's about what's the best vendor to order products listed under the EPA's List N for disinfectants.
Boy, there are several vendors. The problem that there is right now is hitting those vendors at the time that they have the products. And it's very, very difficult to do that. If you have a regular vendor that you have used in the past, such as McKesson or Intilir, you might try them. But again, as I said, RCMA probably by Monday at the latest, we will have a resource that physicians can order directly from in smaller quantities than what has been required in the past and at a more competitive price, because we know the prices have gone up dramatically. So we will have that information, but I think any of the vendors are providing the disinfectants. The problem is you just have to get it when it's available.
Thank you, Dolores. And, you know, the other question that surfaced related to this is what type of help is available for getting PPEs?
What type of help is available? Again, through both RCMA
providers work with us to get more PPEs.
Correct. So both RCMA and SBCMS have been providing PPEs to their members based on availability. And we continue to do that. We have also sent out a survey order form, if you will, for physicians to complete to give us an idea about quantities that are needed out there, and we are working to source those quantities. So if you're from Riverside, make sure you contact RCMA and place your order. And if you're in San Bernardino, contact SBCMS and discuss with them the PPEs that they may have available.
Thank you, Dolores. Okay, it looks like we've answered all the questions. Again, I want to thank you, Dolores Green, for your leadership. I want to thank Mitzi, our co-presenter, who did a phenomenal job today, and the entire RCMA staff who's worked diligently to provide all of these resources. In closing, please don't hesitate to contact us. There's a wealth of information that's been gathered on the website, but if you have personal questions or questions relating specifically to your practice, please do not hesitate to use the support resources that are listed on this page. With that, I want to take this opportunity to thank all of our providers, everyone on the front lines. Thanks for your commitment, your caring, and your dedication to those who entrust their lives with us. Have a wonderful day.